Hello there, welcome to my show, COVID-19 Update by Heerak. Today is Friday the 13th, November 13, 2020. And you're listening to Tunisian folk music from Tunisia in Northern Africa. When I was in Israel, I lived in Israel for over 3 years. My best friend, Serge Gourmand, who's a French guy who immigrated to Israel, he's Jewish. He his family has a beach property in Bat Yam. Bat Yam means daughter of the sea, and Bat Yam is a neighborhood filled with a lot of northern African Jews, like Algerian Jews, Moroccan Jews, Tunisian Jews. And they're all French speaking. So yeah, I just kind of remember, I'm reminded of those nice days. A lot of friends from Northern Africa, Jewish friends, because Sales Gourman and I, we were at the Hebrew University of Jerusalem in Israel, and we'll take, weekend trips to his family beach home every weekend. It was great. um, Yeah, I don't know if you've seen like Friday the 13th movies. Those are classic. They're fun to watch, since today is Friday the 13th, I thought, I'll share some of it. The Friday the 13th movie poster with you there. Yeah, many of you may have already seen it, and it's a little kitschy, but it's kind of entertaining. Yeah, so again, we had over 1,500 COVID-19 deaths in the 24-hour period in the United States of America. So we can see the death is spiking up. It's beginning to spike up. So we have 1,585 COVID-19 deaths in one day. And yeah, so we have 244,207 COVID-19 deaths so far. And in terms of cases, we have 10,713,452 confirmed cases. Um, yeah, so it's not good. Um, Places are beginning to shut down in America, like Illinois, Chicago. Um, Schools are beginning to shut down in different areas. So soon, maybe within like few days, we'll see states shut down. So we may have states shut down starting this week. And Virginia may shut down. Governor Northam may issue a stay-at-home order next week or the week after that. So that's coming. And most likely the stay-at-home order will have to last until like May. Because we have this long flu season. Right now it's November, December, January, February, March, April, May, and then June. So we have quite a number of months of COVID-19 death to go. Um, yeah, so it's going to be pretty horrific. In terms of what we can expect. Um, yeah, it's going to be sad. As you know, I'm Heerak Christian Kim, candidate for U.S. Congress in Virginia's 8th District for November 8, 2022 election. That's 2 years from now. As you know, U.S. Congress election is every 2 years. Um, and so I've started campaigning for year 2022, 2 years from now. And I call this 2 years like the COVID-19 2 years because we started um, with COVID-19 and we're going to COVID-19 for 365 days a year for the next 2 years. As you know, Dr. Fauci said we're going to have COVID-19 until end of 2022 at least. I actually think it's going to go far more than that, maybe decades. It could even be forever, like HIV virus or hepatitis C virus. So, yeah, basically every year you have to do the same thing. Around October, November, everything has to start shutting down, and everything is going to be shut down until like May. So that's coming. It's going to be like that next year too. It's going to be like the year after next. Um, and a lot of people dying. I'm predicting 3 million people to 30 million people will die in the United States alone by June 2021. You can see all the numbers of cases, and as you know, more cases, more death. So, um, yeah, so that's coming. So that's really sad, but that's what you can expect. Um, I'm wearing my Georgetown University shirt. As you know, I was the vice president of Georgetown University Graduate Student Government, GradGov, from May 2019 to May 2020, and have done some amazing things. So this is one of the shirts that we made at Georgetown for all graduate students, and we handed it out during special events. Um, yeah, it's nice, I'm glad, I served Georgetown University community as a vice president of the graduate student government GradGov for 1 year, from May 2019 to May 2020. We had a lot of many important fruitful things done. I was like a fun guy, in the GradGov executive board. Um, yeah, and I had the pleasure of campaigning for U.S. Congress while I was a vice president of graduate student government. Um, yeah, people work. It's not like in a democracy. You have to quit work to start running for U.S. Congress. People run for U.S. Congress while they are teachers, while they are nurses. While they're I'm a nurse right now. While they are professors, or while they are businessmen, while they are healthcare workers, social workers. So people work, and that's what makes democracy great. Ordinary people from ordinary walks of life, truckers, waitresses, you can all run for U.S. Congress. If you have enough votes, you win. And so I'm a good example of how democracy works in America. That anyone can run. People who are working part-time, full-time, several jobs can run for U.S. Congress. So I'm an example of what American democracy should be. So I know I'm an inspiration to many of you out there watching me around the world. And many people around the world have a renewed respect for America because they know that I'm running for U.S. Congress in Virginia's 8th District, which is Arlington, Alexandria Falls, Church, and Fairfax County. Um, yeah, so this is America, right? Ordinary people, every citizen can run for office. There's no citizen who cannot run for office. Um, it's that's what it makes America great. Um, look at the top 5 cases of COVID-19 in Africa. South Africa remains number one at 746,945 cases. They have 3% death rate. They have 20,153 deaths so far. And Morocco is number two at 282,336 cases and a 2% death rate. 4,631 people have died. Um, so that's like what, 2, 3 days in America. In Morocco, it was like since November 2019. In Egypt, there's 110,319 cases, death at 6%, 6,429. So it's about a week's tally in America, 5 working days tally. Ethiopia has 1,757 cases, and their death rate is 2%. So total death in Ethiopia so far is 1,558, which is less than 24 hours of COVID-19 death in America in the last 24 hours. There are a lot of Ethiopians who live in Arlington, Alexandria, Falls Church, and Fairfax County area. Um, this area is probably the most heavily concentrated Ethiopian area in America. Immigrants from Ethiopia. Um, yeah, so Ethiopian food is quite good. You know, I tried Ethiopian food and it was really great. You know, Ethiopia is in the Bible, and they say, you know, Kushite, like it's like Ethiopian, and yeah, Solomon, one of Solomon's wives was Ethiopia. Solomon had 1,000 wives. Well, you know, so yeah, I mean, I guess he had sex with all 1,000 women who were his wives. It's hard to keep up, I guess, if you have 1,000 wives like King Solomon did in the Bible, you know, because there's only 365 days a year. So even if you rotate, it has to be like, you know, like you get to have sex once every 3 years. If, you know, but I'm sure, you know, Solomon had his favorite, like the, Solomon had his favorite wife, with whom he probably had sex more often with. But yeah, it's Bible has a lot of shady characters. You know what I'm saying? But Bible is very honest about flaws that people have. You know, Bible tells us about King David and Bathsheba, right? So Bible's the truth. You know, it gives us everything. And that's why I like the Bible. You know, Bible teaches us how we should live. The Bible also shows us the flaws that people have, even people of faith, like King David, who's an example of faith. He has flaws. And that just shows us that all of us are sinners, you know, and need salvation in Jesus Christ. Tunisia is number 5, and that's why I'm sharing the folk music from Tunisia with you. That's pretty nice, right? Tunisian folk music is a little bit different from, you know, music from Lebanon. It's different from music from Saudi Arabia. Different from music from Egypt. Um, Tunisia has 77,668 cases, 2,209 deaths, death at 3%. So, you know, a little over one day's tally in America. Morocco and Tunisia in northern Africa. Egypt is also in northern Africa. Ethiopia is a little bit more south, and South Africa obviously is in the south. But there are countries in Africa where they really don't have any COVID-19 deaths, or just a handful of deaths. You know, literally you can count on your hand. So, but that's not the situation in America. Unfortunately, we have a lot of COVID-19 deaths. So our case is somewhat different, you know, from other countries. Um, yeah. I wanted to share some photos of Nadine Lohmann from Hamburg. As you, I've shared with you, I met her when I was kind of traveling in Germany, uh, and she was selling flowers. So she's like a flower girl. She graduated from high school to not go to college and started working full time just selling flowers at a flower shop. So I guess she started working full time like 18. And I got to know her, and then she flew over to visit me in California from Germany. Deutschland über alles. You know, I like German. You know, so Nadine flew over to visit me in Germany, in America. I don't know how many flowers she had to sell for that. I guess she got paid like an hourly wage, but I guess she saved up and then flew over. You know, I'm an expert of Jewish studies. I have no money, so if a woman wants to come visit me, she has to pay her own way, right? So anyway, so she paid her own way to come visit me, and you know, and we had a lot of fun. You know, she stayed with me. so she'd have to pay for like housing. Um, and then we had combination of cooking food and eating out, and I treated her out, and then she treated me out for a little bit, and we kind of like, we kind of went basically 50-50, because I'm an expert of Jewish studies. I don't have any money. You know what I'm saying? Well, at that time, I was expert of Jewish studies, and I didn't have any money back then either. So, yeah. So, but it was fun. I was taking some doctoral level Jewish studies courses at Claremont Graduate University, which is basically a combination of Claremont, McKenna College, and the Claremont colleges in Pomona College. So I worked with several professors in Claremont on Jewish studies, and the dean came to some of my doctoral classes. Um, yeah, so we had fun, and I tried to take some artistic photos. So you see some of these photos. I tried to capture, her essence, her feelings, her sentiment, And so, maybe you like these photos. I don't know. I have an artistic side. As you know, I'm a poet. You can read my poetry books. If you Google my name, Heerak Christian Kim, on Amazon.com, you'll see some poetry books that I've written. And you can read those, or listen to poetry through audible books. And I think you'll like these poems. So, we had a good time. Nadine visited me for like, I guess almost a month, and we had a fun time. That's why I took her to my classes, because I did like what I normally do. But I set apart some time to just like have fun. So that's good. Um, yeah. So we went to Chinatown, had some Chinese food. Nadine really liked the food. It's better than Chinese restaurants in Hamburg, Germany. So yeah. So she was happy. We had a great time. We just did a lot of fun stuff together. And hi Nadine. Yeah. So today, we have this news. Schools are shutting down in America. As you know, I predicted this in the summer. If you go back and watch my shows from June, July, and August, I said that we're going to be shutting down for like 6 months of winter. And I predicted this. So it's coming. My predictions are coming true. And we are entering 6 months of shutdown that is beginning. Because as you know, in April in New York, people were infected with COVID were dying at like 10% rate. And just that just kept coming. And this was for 1 month of April because it kind of started like in late March, right? My show started April 2nd. On April 2nd, there were only about like 5,000 to 7,000 deaths. So majority of the death in New York happened in April, end of the flu season. But this year, we're going to have the beginning of the flu season starting, and we're going to head on to like March. So we have like 6 months. So we're going to have 6 months of death, and death rate can go up 10%. Obviously, that's how it was in April, but it could go up much higher when the hospitals run out of beds, when the nurses get sick and die. You're going to have a lot of people getting sick and dying. A lot of nurses will die. I'm predicting that at least 10,000 nurses will die in the United States by Christmas 2020. We have like 50 days to go, and death is spiking up, which means, nurses will die because nurses take care of the patient. So obviously, we're going to have a lot of nurses die. There are 4 million nurses in America, so 10,000 nurses are just a drop in the bucket. Obviously, every life is important. And I hope that no nurse dies, but we have nurses dying right now from COVID. Right, out of 1,500 plus people dying, a lot of them are healthcare workers, and many of them are nurses. So nurses are dying right now every day. Um, so saying that 10,000 nurses will die by December, makes a lot of sense. Obviously I don't like it, but this show is about truth and reality, so I'm going to give you the truth about what is going on. I don't believe the liberal media, which tries to make it seem like, people are not dying, because that's not true. They're trying to make it seem like, nothing out of the ordinary is happening. But when you have 1,500 people dying, that's not normal. That's not ordinary, right? These are real people with real lives dying every day, like 1,000 people dying every day. So, I treat it very seriously, um, because every life is important. Um, yeah, so let's look at the first article. Montgomery County orders schools to go all virtual for 2 weeks around Thanksgiving holiday. As you know, Halloween parties and trick or treating shot the cases up. We had like 70, 80,000 cases per day. And then after Halloween parties, the week after, we saw the sharp increase to like 120,000. So it went up like 50%. And now it's constantly going up. We're up to like 150,000 cases now. We may hit like 200,000 cases by next week, Friday. Um, and after Thanksgiving, we may have more than 200,000, like 300,000 cases per day. And at 10% death rate, if you have 200,000 cases per day, you're going to have 20,000 deaths per day. If you have 300,000 cases per day, at 10% death rate, you're going to have 30,000 deaths per day. So I'm predicting that we're going to reach 30,000 deaths per day. I think it's going to happen before Christmas. Then we're going to have 30,000 people die every day in America alone. But let's see. We may hit that in January, not in December. We'll see. I think you will hit it in December. So when you're having 30,000 people dying per day, you could easily see how 10,000 nurses can die. And I'm predicting that 20% of my cohort of, from clinical nurse leader master's program at Georgetown University will die before Christmas. So there were 25 of us who graduated at Georgetown University on August 24, 2020. I'm predicting that 5 of us will die before Christmas. So I'm gonna do a cheer for us. CNL 2020, yay! We graduated from Georgetown on August 24, 2020. 5 of us may die before Christmas 2020, but they could write on the tombstone that I graduated from Georgetown, yay! On August 24, 2020, yay! Um, and I think, now I'm at Virginia Hospital Center as an RN resident. So I'm in this 1 year program at Virginia Hospital Center. And, I'm doing really good, saving lives. And some of you have been treated by me at Virginia Hospital Center. You lucky people. Yeah, if you're sick, come to Virginia Hospital Center. You may have me treat you. And you don't have to live in Arlington, Alexandria Falls, Church, and Fairfax County to come to Virginia Hospitals. You could drive from like Fredericksburg, Richmond, Virginia. You could drive from like New Jersey, Delaware. Because I know you guys see my show all over the country, all over the world. So you come for some kind of elective surgery or some kind of treatment. When you're choosing different hospitals, and then you can stay in the hospital for like a few weeks. You could see me, and I may take care of you. You know what I'm saying? But you have to go to the hospital anyway. You know what I'm saying? Um, yeah, Virginia Hospital Center is very good hospital, so I think you'll like it. And if you are thinking about getting a surgery done, like heart surgery or some kind of surgery that you need, you should get it done right away. And Virginia Hospital Center is a very good place to come to get surgery because it's only going to get worse, COVID-19. So you getting it done now is probably the safest and the best thing for you to do because it's only going to get worse. So don't put it off. Make an appointment, come to Virginia Hospital Center, get your surgery done. You may have surgery that's more elective. It's not life-saving, kind of surgery. But you may want to get that done, as soon as possible because once COVID-19 hits, it could be really bad, right? They may not even do surgeries anymore. You remember in April, they stopped all surgeries. So you don't want to be in a situation where you need a surgery and then hospitals all stop surgeries and then you die because you can't get a surgery. You don't want to be in that situation, you know what I mean? So get that surgery done as soon as possible. Call up Virginia Hospital Center, they'll treat you well. Um, yeah, so let me read the significant quote from the first article. Um, Health officials in Pennsylvania's third most populous county ordered schools Friday to temporarily halt classroom instruction in what they said was an effort to contain the spread of the coronavirus. The Montgomery County Board of Health mandated that all public and private uh, K to 12, kindergarten to 12 schools in the suburban Philadelphia County offer virtual instruction for 2 weeks beginning November 23rd. So that includes Phil-Mont Christian Academy, Philadelphia Montgomery Christian Academy, where I studied as an elementary school student after immigrating to America, middle school and high school. The Philadelphia Montgomery Christian Academy is in Montgomery County. That's why it's called Philadelphia Montgomery Christian Academy or Phil-Mont Christian Academy. So yeah, my school, Philadelphia Montgomery Christian Academy, is in Montgomery County. So that's the county where my elementary, middle school, and high school was in. And that's also where Bibi Netanyahu, Benjamin Netanyahu, the Prime Minister of Israel, where he went to school at Cheltenham High School. And that's where one of my friends from University of Pennsylvania Alumni Association told me. Um, yeah, one of the executive board members at Penn Club of DC was that's what he told me, the former president of Penn Club of DC. Yeah, it's kind of interesting, small world, ain't it? Yeah, interestingly enough, he has a last name Levinson, which is the same as my teacher at Harvard, John Levinson, Liz Professor of Jewish Studies at Harvard. His last name is Levinson. His full name is John Levinson. And this guy who used to be president at Penn Club of DC, his last name is Levinson. So maybe they're related, like a grandson or something. um, yeah, but anyway, or a nephew or whatever. Um, yeah, Montgomery County has a lot of Jews. Uh, uh, there is about 1 million Jews in Pennsylvania, and majority of them live in the Philadelphia suburbs. And the most heavily concentrated area for Jews is in Montgomery County. So that's little demographic information you may be interested in. And that's where Dropsy College was. Dropsy College was a Jewish college, like modern Orthodox Jewish college in Philadelphia area. And my uncle, who's a Christian, obviously, he's a Christian minister, he studied at Dropsy College, Old Testament, Hebrew scriptures. And he worked with Samuel Noah Kramer, who was a professor at University of Pennsylvania, but he was like modern Orthodox Jewish professor. So he taught also at Dropsy College. So yeah, so my uncle, Jin Sub Kim, Reverend Dr. Jin Sub Kim, was Samuel Noah Kramer's last student at the University of Pennsylvania for PhD. Yeah, so my uncle's like a big shot theologian in South Korea. With a lot of influence. He's like probably top leading expert of Jewish studies, in Korea and in Asia. He's a Presbyterian minister. But yeah, he's the one who encouraged me to go to Israel, So yeah, I respect him a lot. Um, yeah, so second article, Cuomo hints of looming restrictions beyond curfew. New York City schools could go remote Monday. So this coming Monday, today is Friday, the Friday the 13th, November 13th. So Monday is November the 16th. So New York schools, New York public schools, to go 100% remote on Monday, the November 16th. So you see how serious the situation is. Everything is going to close down. So we are where we were in March. So what we are experiencing now is what you experienced in March when things start closing down. And then from March to, to basically June, things closed down. Um, it was only about a month. You think about it, and you know how it was for you. This time around, it's not going to be 1 month. This time, when things start closing, we're going to go all the way to like May, because it's continuously flu season. So death rate will continue to go up. Um, yeah, it's going to be bad. I'm predicting that all the hospitals in Washington D.C. area will be completely filled in November. Like it'll be overflowing with patients. That's why I'm saying get that surgery done now, before the flood of before the flood, because it's going to happen sometime in November, maybe around Thanksgiving, maybe sooner, um, or maybe right after Thanksgiving. But yeah, it's going to happen soon. So if I were you, I'd call up like today or tomorrow, arrange for surgery. Like if there's one tomorrow, get one tomorrow. If there's one on Monday, get one on Monday. Get yourself onto that schedule, surgery schedule, get it done. If you have a joint problem or, like any kind of surgery that your doctors say you need, get it done. Because for the next 6 months, you may not be able to. Um, and so, yeah, getting it done right now is probably a priority. Nice. This Tunisian folk music is pretty nice. There are a lot of Arabic people in Virginia's 8th district. My dentist, I have two. My dentist, uh, one of my dentists is from Syria. From Syria, they're 100% Syrian, Arabic, Muslims. And they send their kids to like an Arabic school. Yeah, and they have like their dental practice is called Smile Maker. And Dr. Fadi is my dentist doctor. He's like my dental surgeon, and he's great. They have offices in Vienna. They have office in Tyson's Corner. They have an office in Falls Church. Yeah, Dr. Fadi. Yeah, he's great. And I also have another doctor. More recently, my dentist. She's Iranian. She's 100% Iranian. The father and mother came from Iran, so they're like Iranians. I guess they're like Iranian Muslims. I didn't ask about her religion, but I think they're Iranian Muslims. And then they married. They may be Iranian Christians because there are Iranian Christians. I think maybe next time I go get my dental cleaning, I'm gonna ask her. But she married a Hispanic man. I think he's from Venezuela or something like that. And her dental office is on the same floor as Arlington Democratic Committee office in Arlington. So yeah, she's really nice. She went to University of Southern California Dental School. Very, very good at what she does. She's amazing. Yeah, so I'm really happy with her. Happy with her. I love Dr. Fadi. I like her. They're both great dentists. Um, but dental offices may have to start shutting down because of COVID. I don't know what's going to happen to Dr. Fadi and her. Yeah, if you need to get dental treatment or cleaning, make sure you go as soon as possible. Make an appointment. Maybe to check out Dr. Fadi or my doctor, the other doctor in the same floor as Arlington Democrat Party. If you Google Arlington Democrat Party, it's like in the same building, same floor, second floor. Um, yeah, they're both really nice. Um, Yeah, so the second article, New York State is seeing a very big spike of COVID-19, and I predicted this. If you see my show from summer, I said that's what's going to happen, and I was right. Um, others, with Dr. Fauci was saying, New York is like a good example of how not to have a spike, blah, 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 blah. But Dr. Fauci was wrong, and I'm right. My prediction came true that New York will have a serious spike. So yeah, watch reruns on my show, COVID-19 Update by Heerak. So if you go to Heerak Christian Kim for Congress YouTube channel, you can see all the videos from April 2nd till now. So you can watch the reruns and then see the development of COVID. Um, yeah, so we are in the midst of a sea of COVID rising around us. This is what Governor Cuomo of New York is saying. You look at the international numbers and they are frightening. Yeah, because as I said, millions are going to die in Europe. Um, Cuomo said Friday, that's today. Look at states around the country, and now he's talking about our country, not just international numbers. And the numbers are all going up quickly, right? They're going up suddenly, and they're going up quickly. Like out of nowhere, it's just suddenly going up. You cannot defy reality, right? I'm happy that Governor Cuomo is coming around to my position, right? That's what I've been saying. Um, you cannot defy reality, and reality is the viral transmits, and the virus is mobile, and we're in the holiday season. These are all elements that conspire to increase COVID. The numbers are going up. The numbers will go up. Yeah, that's true. That's what I've been saying. I take that as a fact. Yes, my show has been saying that. I've been saying this on my show for the past several months, right? I'm glad that Governor Cuomo is realizing that I'm correct. U.S. Christian Kim, candidate for U.S. Congress of Virginia's 8th District, is correct. That my show is correct. This is why my show is so important to you and your family and your children. And you should encourage everybody to watch my show every day, COVID-19 Update by Heerak, because it provides you truth, gives you information that you need to survive COVID. That's why you gotta fight to make sure that my show is something that you can access every day, right? Because it could be the matter of life and death for you and your family, for your children, right? Because I'm consistently right. I'm been consistently more right than Dr. Fauci and Dr. Redfield of CDC, Dr. Han of FDA. I've been far more right. I've been right more than Dr. Gupta of CNN, Dr. Cotley, former FDA director. I've been consistently more right. And so you're lucky that you have this show, right? Because you watch this show every day. You gotta watch this show religiously every day. You have a chance to survive COVID, right? I give you information, I give you guidance, and I see that CDC is following my guidance. You see what I'm saying? They're updating their guidance to match what I'm saying that you should do. So can you imagine if you do what I encourage you to do earlier, you have higher chance of survival from COVID-19. That's why this show is so important to you. And this show is a public service to all the Americans, 330 million Americans, and everyone around the world. This show saves lives. That's why you gotta save and guard it with your life, because your life depends on it, right? Don't let anybody take away something that could save your children's life, your life, right? Um, yeah. So, yeah, nice. Habibi means my friend. Habibi. Arabic music is great. My prediction is that New York will have over 1 million deaths by June 2021. Um, if they don't shut down completely as soon as possible, they may have more than 3 million people, like 2, 3 million people in New York may die by June 2021. Because all my predictions are coming true right now, right? My predictions are coming true. Dr. Fauci's predictions were kind of wrong. Um, well, his predictions from like June were wrong. I mean, as things happen, he's revising his predictions too. But I've always maintained that over 1 million New Yorkers can die from COVID-19 by June. But you'll go ahead and watch my show from June. So I've been consistent in maintaining my analysis and assessment as an expert, and I have a lot of expertise that I bring. Yeah, nice music. Yeah, so unfortunately, hospitals are going to fill up. And my prediction is that New York will have number one death numbers again this year because there's so many people in New York City. There's just more people to get infected, more people to die. It's a sad thing, but it's a logical thing, right? Virus transmits from person to person. So if everybody's like crowded and living in a crowded space, it's going to spread much faster. People are going to get sicker and die faster. And hospitals are going to fill up very fast. I'm predicting that all the hospitals in DC areas will be filled in November sometime. And I'm predicting that every hospital in this area will have at least 12 nurses die. So my hospital, Virginia Hospital Center, will have at least 12 nurses die by Christmas 2020. And we're going to find more nurses die from Christmas to May. But before Christmas, we'll have 12 nurses die minimum. Obviously, I don't want anyone to die, but this is COVID-19. It's a global pandemic. You can't escape it. Some people are going to die. The nurses, obviously, are the most vulnerable. They take care of the patients directly. And patient care technicians, many of them are going to die. But I'm just counting the nurses. 12 nurses will die. There may be more than 12 patient care technicians who die. So between nurses and patient care technicians or CNAs, we may have more than 24 die before Christmas in every hospital. Um, the Fairfax Hospital with at least 12 nurses die, probably far more than that before Christmas. As you know, Filipino nurses are the most vulnerable to COVID-19 death. Right now in America, out of all the nurses, white nurses, black nurses, Hispanic nurses, Chinese nurses, Korean nurses, Filipino nurses have the highest death rate right now. No one really knows why that is, but that's what's going on. So, if you're Filipino and if you're a nurse, I would really, really, really worry. Um, yeah, because Filipinos have a very high rate of death from COVID. Um, yeah, I mean, are pretty high up there too, but not like Filipinos. Um, in terms of nurses. Um, yeah, so like out of 12 who die at Virginia Hospital, who knows? Maybe 1/3 maybe like Filipino nurses. Who knows? I don't know. I mean, I don't know. I mean, I'm sure our chief nursing officer will tell us when nurses die. Hopefully she does, so we know what's going on. And then we could count like how many nurses are dying. And I'm sure it's public knowledge. It's not like secret, right? Who dies? Death is public record, right? Birth and death are public record. Um, yeah. And Fairfax Hospital will have 12 nurses die. Um, Alexandria Hospital will have 12 nurses die. Um, Georgetown MedStar University Hospital will have like 12 nurses die or more. Children's National Hospital in Washington, D.C. have more than 12 nurses die. George Washington University will have more than 12 nurses die, and this is all before Christmas, so about next 50 days. So, out of my RN residency cohort, we have like 16. I'm thinking like maybe one or two may die before Christmas. Um, hopefully nobody dies, but just logically speaking, it's possible one or two dies before Christmas. So I just want to do a cheer for my fellow corps members at Virginia Hospital Center. I'm a RN residency program. I'm a registered nurse, RN, but there's 1 year of residency for first year nurses right out of nursing school. That's to help us like become transition well into the hospital setting because we just graduated from nursing school. There's a lot to learn. So we're in 1 year residency where we're kind of being trained and provided with support and encouragement, and we start to become great nurses, but it takes a while. So first year, we have a lot of guidance, we have a lot of support, and that's a good thing. I think that's how it should be. But so because we are beginning nurses, um, you know, uh, I think out of the 12 who died before Christmas, you can expect one or two from each cohort. Like if there's like four cohort, there may be four who dies, one per cohort. Um, I think that's something they could predict. Um, so I want to say RN residency at VHC, Virginia Hospital Center. Yay! We are in it together. One of us or two of us may die before Christmas, but we are in it together. Hopefully, not more than one or two of us will die before Christmas. Yay! Um, yeah, hopefully not. It's always possible more than one or two dies in a cohort. There's no rule that says like only one has to die. You could have like five die from a cohort. COVID-19 is a killer virus, so you can never predict, right? You can have 30 nurses die before Christmas. We just don't know. We do know that numbers are spiking up. Like Maryland had the highest number today, and yeah, so it's shockingly out of nowhere, states are seeing exponential growth. Some people blame like celebrations last week during the election week for the spikes. Because there are a lot of people marching in DC, right, at the Black Lives Matter square. So many of them probably got infected. Yeah. There is a global pandemic out there. You don't just go around spreading COVID and getting COVID. That's just not wise. Let me read this article. Quotes from this article. Uh, just the last line once again. The numbers will go up. I take that as a fact. Governor Cuomo was absolutely right. It's going to go up. And if you go to like large gathering, like the celebrations a week ago, obviously you're putting yourself at risk. And so Maryland has the greatest numbers because of that, with these celebrations. These are not normal times. This is COVID-19 America. You don't just go and celebrate with all groups of people in, in the beginning of flu season. Unless you want a death wish. You know what I'm saying? It's not wise at all. Um, yeah. Now, article number 3, University of Maryland College Park to move classes online beginning Monday, citing COVID-19 concerns. So they're like, keep their students with this big news today. So they have to move out by Monday, right? Like an emergency, kicking out of college students. Isn't that shocking? This can happen anywhere. George Mason University could happen at Marymount University. It could happen anywhere, right? Virginia Commonwealth University. Yeah. So just get ready if you're a student. ready to pack up and leave. Um, so let's read the article. This was in Baltimore Sun. In a message to the university community Friday, President Daryl Pines and Health Center Director Sakared Bodison cited an alarming spike in COVID-19 cases around the state and Prince George's County as reason for the sudden switch. Nice news here. Yeah, so going back to the article, quote, you have pandemic fatigue. We all do. But you must remain committed to the health and safety of our campus and community, the announcement states. All students are encouraged to begin making plans to return home for the remainder of the semester and to arrange for a COVID-19 test. Now, you know, University of Maryland is like, thank God they're going home. But can you imagine they're all bringing potentially asymptomatic COVID-19 cases will create symptomatic COVID-19 cases in their parents. So maybe some of these college students have COVID, but they don't feel the symptoms that much. Maybe they have like mild symptoms. But when they go home, their mama, their papa may get COVID, and they may be on an incubator too, and then die before Thanksgiving. It's going to be tragic. We're going to have a lot of cases because as college students go home, some of them are going to bring asymptomatic cases back. False negatives, like COVID test says that they're negative, but they're not really negative, so they infect their parents and they die. It's going to be tragic. This is why I say colleges should not have opened. Like in August, I said no college should open physical campus because eventually the students have to go back home. And when the students go back home, they could bring COVID to their parents, their family, their neighborhoods, and there's going to be another spike from students returning home. Watch, that's going to happen. So that's the irony. If the students remain on campus, colleges are liable, right? When the students start dying in large numbers, what are they going to burn the bodies on campus? You know what I'm saying? If they send the students back, so many of them are going to carry COVID-19 with them. It's going to spread all over. You're going to see a spike all over Maryland because a lot of the students who study at the University of Maryland, are from Maryland, like every corner of Maryland. So you will see a tragedy of epic proportion developed in Maryland. Obviously, they're in a lose-lose situation, right? They can't really keep the students there because you're going to have thousands of students dying. Potentially, if you keep them in like close quarters, you may have hundreds dying, thousands dying, you may have dozens dying, whatever the case may be in the next few months. So University of Maryland doesn't want to be liable for the death of students, but as they send the students back home, some of them are going to be bringing COVID to their communities. So it's a lose-lose situation. This is why I say you should have just done 100% online learning from the beginning, and you would have escaped at least this double whammy effect. But no, you didn't listen. I worked 3 months to close down Georgetown University to save Catholics. Majority of the Georgetown University students are Catholics, Catholic families around the country, and they were going to bring the freshmen, like first year students on board. I lobbied and lobbied to close down also for first year students, and I won. So Georgetown University closed down completely. So no students came on campus, right? Except a few exceptions maybe, but like undergraduates, none of them, all the classes 100% online. Graduate students, 100% of the classes online. Because I lobbied for 3 months to save the lives of Georgetown students. That's how influential I am at Georgetown. I worked hard to make sure Georgetown was 100% online. I know the kind of power I have, the soft power, and I use it for good to save lives. You see, I have a lot of influence at Georgetown University. I have a lot of influence, in many places, and I use my power for good. Um, but obviously, I have to use my power for bad. Yeah, I'm just kidding. I'm just kidding. Um, but am I? No, I'm just kidding. I'm just kidding. Um, yeah. Harry's like looking at me all amused, He's like, this is amusing, He's like wobbling his head. I don't know if that's like fear or what, or maybe he's just kind of cold and shivering. Um, yeah. Anywho, yeah, um, yeah. So things are bad, Things are getting bad, and things are getting bad suddenly. That's the important thing. But logically speaking, you should not be surprised because in science, you understand why there's a cause and why there's an effect. And that's what we study. We had uh, Halloween parties and trick or treating. So obviously cases went up from that. And then there were these people celebrating in the streets and at home. Obviously, you know how teenagers and college students are. They celebrate in the street. That's not where the celebrations end. You know what I'm saying? They celebrate in the street, but then they take the celebrations back home, right? Um, and some of them share intimacy, maybe with strangers. And so you can imagine how fast COVID-19 can spread. Um, and unlike AIDS or sexually transmitted disease, where you have to have population to get it, um, with COVID-19, you could just sit for coffee and talk to a woman, and get it. So it spreads much more fast. You know what I'm saying? Um, yeah. So there's an explanation for why things are happening the way they're happening. Why COVID-19 is spiking in New York? Why COVID-19 is spiking in Baltimore, Washington D.C., Virginia? Why COVID-19 is spiking in Philadelphia? There's an explanation for this. So, um, Chicago, um, like in cities, there's a greater spike because of the last few weeks. Um, yeah, so that's, I guess, that was a curse after all, right? It wasn't really a blessing because we have such high spikes of COVID now. It's absolutely ridiculous. So, But yeah, we have like 150,000 new cases in the last 24 hours. So a lot of people are going through their death. And that's the sad tragedy of what's happening right now. Um, as I said, Heerak Christian Kim, candidate for U.S. Congress in Virginia's 8th District for November 8th, 2022, 2 years from now, general election. I'm predicting that minimum 3 million United States citizens will die by June 2021, but more like 30 million U.S. citizens. I mean, there are 330 million Americans, so that's only like 10% of the population. But obviously, we don't want anybody to die, so it's a large number. Um, you can't avoid it. You see these cases spiking, they're going to eventually end up in death. Deaths are going to spike. Right now, we're talking about spiking cases, spiking hospitalization. In a week or two, we're going to talk about spiking deaths. Every state's going to have like an incredible number of deaths. It's going to go to like over 100, then over 200, over 300, over 500, over 1,000. We're talking about each state. So if there are 50 states, and every state goes to 1,000 deaths per day, that's 50,000 deaths per day. You see what I'm saying? Uh, I'm thinking more like 30,000, but who knows? Maybe we could hit 50,000. With every state is spiking. Even Utah is spiking like crazy. Who would have thought Utah would have such spikes in COVID, right? So this is happening everywhere. Um, I'm predicting that 1 million people will die in the Washington, D.C. area, what we call the DMV area. DMV stands for um, D.C., D, M, Maryland, V, Virginia, DMV area. So I'm predicting 1 million people will die in the DMV area from COVID-19. And I'm not even counting common cold, flu, strep throat, mononucleosis. So the total death may be like 2, 3 million. If we count all the other things like cancer, people who would not have normally died from cancer will die in the flu season because hospital treatment is not available and they're immunocompromised. Some of them will get COVID and die. Some of them will be infected with other things like, MRSA or, E. coli or, uh, salmonella, whatever. You could die from all kinds of different infections. So those are not COVID-19 infections. Those are different infections. So if we count all of them, I'm thinking like 2 to 3 million people in this area will die by June. Like, Maryland, D.C., and Virginia, here in the area. It's going to be tragic. I mean, I think every one of you watching this show will know somebody close to you died, like your husband or your child, your daughter, or your son, or the baby you just got. Baby was born 2 years ago. You're gonna know someone who died. Like maybe your sister, maybe your husband's sister, maybe your father, maybe your mother, maybe your stepfather, maybe your stepmother, maybe your uncle, maybe your cousin. Somebody you know will die. At least one. Um, it's tragic, it's sad. So all of you need to be very careful. The smartest thing to do, and I've said this many times in the summer, is socialize only physically with people in your household, meaning you live with them. As long as there's no COVID there, you're kind of safe in that area. So socialize with them physically. Everyone else, you use Zoom or Skype or video phone, conferencing phone, whatever, or just traditional telephone or chatting online to socialize. Don't meet physically because that's just asking for it. You're not seeing the high death. I mean, we have 1,500 deaths per day is high, but you're not seeing 30,000 deaths per day yet. So you may not be that scared, but it's coming. 30,000 deaths per day in America is coming. It's coming in a few weeks. Um, yeah. So I'm just trying to prepare you mentally. I don't believe the liberal media that tries to play down the COVID-19. Yeah, you You need our support. That's why I'm here. Our residents need our support. This is why this show is there, to provide you with support, right? Um, I fight for you and your children's lives. You fight for me and this show, right? That way we help each other. I'm helping you and you're helping me to help you. In the end, it benefits you the most. Um, so you're very lucky that this show exists. You're very lucky that I exist in this world. Where would you be without me in this world? Really, let's be honest here, right? Where would you be without Heerak Christian Kim in this world, right? You're very lucky because Heerak Christian Kim exists in this world, um, to provide you with facts and data and analysis you need to survive and to save your children from COVID-19 death, right? I worked for 3 months in the summer to close down all the public schools in Virginia's 8th district. Arlington Public Schools, Alexandria City Public Schools, Fairfax County Public Schools, Falls Church Public Schools, all 4 of them. And I successfully made sure they didn't open physically, but they only did remote learning. Fairfax County Public School was going to open the school like in a hybrid format a couple of days a week. And I said, no way, Jose. I tweeted away and I lobbied for you and your children so you don't die from COVID. So that's why you're very lucky. You're very blessed. Um, yeah, so I fight for you, you fight for me, right? Right? We're in this together. I fight for you and you fight for me. Yeah. So, I'm glad you're watching this show. And, I'll look forward to seeing you again tomorrow. And I'll provide you with more information that you need to survive COVID and to save your children from COVID. You can be the heroes of your children's lives, literally, right? So watch this show without fail every day. If you're married, discuss issues that I discussed here with each other. Create a strategy for your own family in your own family situation to survive COVID-19. That should be your absolute priority now. Nothing else is really that important. Because who cares who won the election, right? Right? I mean, does that save you from COVID-19? You see what I'm saying? Um, so you need to prioritize survival of your family first and foremost, and then go to other things, whether it's politics, economics, or whatever. But there's nothing more important right now to you than saving yourself from COVID-19 and saving your children from COVID-19. There is absolutely nothing more important, right? Would you agree? So prioritize your life, prioritize your situation to ensure that you survive COVID-19 and that your children survive COVID-19. And this show is absolutely necessary for you to survive COVID-19. You need the information, the facts and figures, the data, and most importantly, expert analysis by Heerak Christian Kim, the Leonardo da Vinci of 21st century. Yeah. So I'm glad to see that you understand your need for this show and for me to help you survive COVID-19. All right. Step one in any kind of survival is knowing who to ask for help, right? And what you're watching this show is a sense of searching for help, right? Direction to survive COVID-19. So you made the right choice. So I look forward to seeing you tomorrow. Make sure you tell all your loved ones and all your friends and relatives and neighbors to watch this show so they can survive COVID-19 too. See you tomorrow. Bye.